Hi, everybody. I'm Brian Duffy. Welcome to this edition of 19 Newsmakers. This is a show that we bring to you every Monday night that streams. It's also a podcast. But what we're doing here is we're bringing in the people who are making policy, who are making decisions that are affecting our day-to-day lives and also affecting our future here in the city of Cleveland. That's why we're calling it Newsmakers. And we are pleased to have as our guest this week Dr. David Margolius, who's the director of the Cleveland Department of Public Health. And Dr. Margolius, let's start with this. What is the Cleveland Department of Public Health? What exactly is it that you guys are trying to accomplish on a day-to-day basis?
Yeah, thank you so much for having me. This is just a great opportunity to talk about the work we do and make it more visible. So public health, we are here to improve the quality of life in the city of Cleveland and improve life expectancy. A few years ago, we had just 90 folks, and now we're up to 150 folks in my fourth year leading the department. And we do everything from monitoring air quality for the entire county to birth and death certificates to community health workers that visit new moms to following up on lead poisoning cases, restaurant inspections, and everything in between.
Everything that affects everyday Clevelanders and their health, everything that you could think of, right?
Yeah, that's right. You know, and basically what we're up against in the city of Cleveland is multiple factors causing our life expectancy to be shorter in a lot of our neighborhoods. So there are folks in some neighborhoods who on average are living into the 60s, while in the inner ring suburbs, the life expectancy is in the 80s. So we have our work cut out for us.
Yeah, that is a big job. How do you go about tackling that? And I know there is so many avenues to do that. So let me ask the question this way. What is the number one health issue that is facing Clevelanders? What's keeping the life expectancy so low as opposed to some of the suburbs?
Yeah, ultimately, you know, the reason our life expectancy is shorter in the city of Cleveland is poverty and concentrated poverty. And it's not that folks come to Cleveland and become poor, it's that when folks have gained wealth, they left the city. And so what that left us here in Cleveland is just fewer resources. And so the built environment with less resources is hurting people and you know, shortening our lives.
And so you say resources and you say environment. This is all. What do you mean by that specifically? What lack of resources do we have because people are moving out?
Right.
And what is the environment that's causing that life expectancy to be so much lower than it really should be?
Yeah, one example I often use when thinking about the built environment and our health is the roads. So in Cleveland, we have a really high rate of traffic fatalities. You know, people either getting hit by cars and dying or cars hitting stationary objects and dying. And it's not because people are getting different training, you know, on how to drive in different places, but it's because of this built environment where we've got these big wide roads instead of lots of trees and narrow roads where people are driving too fast and then it causes people to die. So that's one example where the city of Cleveland is working so hard to change that built environment, build narrower roads, roundabouts, speed tables, plant more trees, bike lanes, bus lanes, and that causes people to slow down and people are going to live longer.
Yeah, when you think about it, you know, I think about Chester and I think about Superior and I think about St. Clair, and soon as those roads, specifically I think on the east side, maybe this is more of an east side problem than a west side problem, but as soon as you get past 13th Street, East 13th, and they just become, I mean, it's like the Autobahn
freeways,
out there.
That's right, exactly, yeah. Yep. And so that's the work. We know the 5 to 10 streets where most of these mortality or incidents are happening. And so we've started the work to fix those roads. It's just these are years-long projects. And so you'll see a lot of new fast builds throughout the city of Cleveland. That's all public health. That's all the work of saving lives.
That also speaks to, you know, what's been done on the corridor, Euclid Avenue corridor between here in getting those areas developed. You also mentioned resources. Our resources are not where they need to be from a financial perspective to help a city that's dealing with the poverty that we're dealing with. Correct?
Yeah, and so you'll see in the city of Cleveland, you know, our residents have less access to healthy grocery stores, for example, and that's just because, you know, the business model isn't there to support these grocery stores, and so what folks are left with in our city are buying food from gas stations and smoke shops, you know, essentially, and corner stores, and so, you know, we are trying as a city to figure out how to best support local grocers to make healthy food, healthy fruit and vegetables more available for the city of Cleveland.
Let's stay on that food desert. Or is Cleveland still a food desert?
There are areas where people just don't have access to fresh fruits and vegetables, so absolutely.
And what can be done about that? That's tough. Dave's does a nice job. There's a Constantino's, there's a Heinen's. But when you get out into the neighborhoods further out, really on the east side a lot is a problem. I know it's still an issue at times on the near west side. It could be. It's hard. And again, thanks to Dave's and the people that are here in the city, but it's kind of like those stores have to make business decisions, and right now that's a tough decision for them to make. Yes? No?
Yeah, and we're so grateful for their loyalty to the city, and we've got to return the favor. I think what is happening for residents across the country right now is they're feeling the pinch when it comes to the grocery bills, and it is a responsibility of us to help improve health, and if that means making groceries more affordable by supporting grocery stores, then the government should do that and step in.
And when we're on this topic, let's talk about this. The funding and the financing just isn't there anymore that we've seen in the past from the federal government, maybe even from the state government. You could tell me, are we having a problem with the funding we need?
Oh, absolutely, yeah. So more and more the state has reduced the funding that they give to cities across the state, and they're kind of holding it in a rainy day fund instead of supporting residents here in the city. And so all that matters. The biggest hit the grocery stores took earlier was when the food stamps and SNAP got cut, and so grocery stores just aren't able to have as many clients as they were earlier this year.
Okay. Our guest is Dr. David Margolius on this edition of 19 Newsmakers. We're going to take a quick break. We've got a lot of ground to cover. There are a lot of success stories here that we want to talk about, but we also need to zero in on some of the things that still need a lot of work, and that takes a lot of people to get that done. We'll be right back.
True crime lives here. Watch Dark Side of the Land on 19 News Plus.
Okay, welcome back, everybody, to this edition of 19 Newsmakers. Our guest this week is Dr. David Margolius. He is the director of the Cleveland Department of Public Health. We've talked a lot already, Dr. Margolius, about what really is at the crux of all of this, and that's increasing the life expectancy and the life expectancy, good years of life expectancy as well, and that includes a lot, including making sure that people have access to what they need in their everyday lives. And some of that deals with healthcare. And right. That's been an issue, has been an issue. Sometimes it's better than at other times. What is the struggle right now with healthcare for people in the city of Cleveland?
Yeah, the big change is really they're trying to roll back a lot of the Medicaid expansion and make healthcare insurance more expensive than it once was. So back 10, 15 years ago, 1 in 4 Cleveland residents didn't have health insurance, and that meant they had to choose between going to the hospital and buying groceries for their family, essentially. But thanks to Medicaid expansion under Governor Kasich back then, we've saved a lot of lives through that, and it's not perfect, but most recently the federal government passed a law, and now Medicaid enrollment is getting tougher and tougher, and we're kind of going backwards where more folks are going to have a hard time accessing health care without insurance.
So what are they doing in those situations? Are people in our city just not going to the doctor?
Yeah, that's the concern. And so, we're not back where we were 10, 15 years ago, but folks are delaying care, delaying their colonoscopies, delaying getting mental health care or seeing their primary care provider because they're worried about whether or not they have insurance.
And how about Metro Health in that situation? Is Metro Health, do people, and I don't want to make this too simple because there's nothing simple about it, but if people have a health crisis, can they go to Metro Health and get the help that they need?
Absolutely. Metro Health will take care of anyone regardless of their ability to pay. The challenge is, as there have been more and more folks coming without insurance, they've had to implement a sliding scale for folks. And so sometimes even a little bit of money is too much for folks who are, would rather buy groceries than health care.
And that all feeds into what you talked about right at the top of our show, in that the age expectancy is really not where it needs to be. Another issue that's certainly bringing that down in the city of Cleveland is people and their ability to get their hands on guns. Violence in our city, where we've got too many young people who are taken from us due to violence on our streets. That has gotten much better. The city of Cleveland, the mayor, the police chief, Dorothy Todd, have done a great job bringing that down. But there's still too many lives being taken.
Yeah, anytime someone dies in the city of Cleveland from gun violence or guns associated with suicide, that's one too many, and we really want that number to be zero. But unfortunately, nowadays everybody has access to a gun, and so maybe before, if they'd gotten in a fight, they would have been using their fists or knives, but now they're going to grab a gun, and so that's why we're seeing this homicides that we do see. They're not random for the most part. Usually our solve rate is one of the highest in the nation, and so we're able to find the folks, but it's still too high, and we're trying to do as much work as we can to continue to reduce that rate.
Okay. I want to talk about some of the positives, because there is a lot of positives, and I know smoking and tobacco is a story that we've worked on together, multiple stories, and there's a lot of tentacles to this. At one point, I know Cleveland had the highest rate of smoking in the country.
That's right.
Is that still true?
No, so thank goodness. So when I started, our most recent data showed that our smoking rate was 35%. 35% of adults smoked cigarettes in the last 30 days, and the national average at that time was 15%. Well, thanks to a ton of work and a large coalition called the Breathe Free Coalition in the city of Cleveland, we've gotten together healthcare systems and students and elected officials and community groups, and we passed some legislation, and we've gotten our smoking rate now reduced to 19%.
19% in Cleveland compared to what is the national?
11% for the national average.
So
still work to do.
But that gap has
right.
closed significantly. Where do we stand as a city nationally?
We're probably closer to the middle of the pack now.
Okay.
We're lucky now with the most recent data, and so other cities have come down too, but not at the speed that we've come down here in Cleveland.
And I think what we need to speak about is the momentum that we have, and that how do you keep that momentum going? And I know there's been some, you mentioned the legislation with advertising. I mean, so we found, when we did our story, we found advertisements all over the place that were illegal in some cases, and then licenses. Is that what's going to help the momentum?
Every little bit helps. So we talked about the environment, changing the environment. Now, if you're someone who smokes, chances are you want to quit. Most smokers want to quit. But if it's always in your face, it's really hard. And so we passed this legislation, working with our Cleveland City Council, and now we've got over 400 tobacco retailers that have a health permit, which means we can go in there and do inspections. We can use secret shoppers to make sure folks aren't selling to under 21, and work on the advertising as well. And so, every little bit helps. We would love the federal government to step in and do what they promised to do by ending the sale of the flavored products, and we're still not giving up on that. But every little bit helps to help Cleveland breathe easier.
I was going to ask you about the vapes, and I know how big of a problem that flavored vapes is, especially because it's catering to young people.
That's
and
right.
Then once they start there, it's so easy for them to go on to become smokers. And that's, if you get them early, the smoking people believe they've got them. So you've got to figure out a way to get those young people early.
Yeah, so if you're someone who smokes cigarettes and you switch over to vaping, that's good. Honestly, it's not perfect, but it's better than smoking a cigarette. But the problem is vaping, the nicotine tobacco companies, they're not looking to help people quit smoking. They're looking to recruit new customers. And that's why the flavors they're putting out are like mango tango and strawberry jazz. And they haven't stopped with vapes. Now there's these Zins and these nicotine crystals. And nicotine, for folks under 25, it interferes with the brain development and causes lifelong memory problems.
Okay. We're making progress, though. That's the good thing about smoking. That is incredible news, and a credit to everybody who was involved in that. I know a lot of it was your office, but there are a lot of other people involved. Okay, we've got two other very positive things to talk about, and we're going to do that right after we take this quick break on 19 Newsmakers.
First Alert traffic and weather together all morning long. Stream 19 News this morning on 19 News Plus.
Hi, everybody. Brian Duffy back with you on this edition of 19 Newsmakers. Our guest, Dr. David Margolius, the director of the Cleveland Department of Health. And Dr. Margolius, let's talk about lead poisoning, because this is another success story. And if you talk to a lot of people like me, I would just assume we're talking about lead poisoning, we're talking about water. And that's the first thing I think of. Is that the number one problem in Cleveland as far as lead poisoning go? Is it coming in through these... The Cleveland water is great, but the pipes, the lead pipes, is that the biggest problem?
That's not the problem, and it is what most people think about when they hear lead poisoning. They think about Flint, Michigan, and they think about the water. But in Flint, Michigan, it was a unique situation where the city manager basically sold out the city with this more corrosive water supply, and it chewed through their old lead pipes that we all have. In Cleveland, the problem is paint, and that actually is the number one cause of lead poisoning in the country is lead paint dust.
Wow, that's because a lot of people, and maybe it is just Flint that jumps to the top of your mind, because I know that was it for me, because I know what a great job Cleveland Water is doing and trying to replace all the lead pipes here. But wow, it's paint. So where is that paint coming from? Is it trim work? Is it windows? Is it all throughout the house? How big of a problem is this right now? Because you have done a good job.
Right.
And tell us about how you've been able to cut the number down.
Yeah, so Cleveland's lead poisoning rate just a few years ago was 18%. 18% of babies tested with positive for lead in their blood. And that's because our houses are so old. And not only are homes old, but they've been disinvested. They haven't gotten the type of regular maintenance and investment that homes maybe in the suburbs have gotten. And so you've got old houses, over 100 years old. Lead paint got banned in 1978. It's particularly dangerous, the lead paint, around old windows, doors, and porches. And so we see it in the foundation, we'll see it in walls, but it's really those areas of friction and impact that create lead paint dust that babies crawl and put in their mouth, causing irreversible brain damage.
So are they eating chips of lead paint? Are they breathing in the dust, or is it
for the most part, it's really the dust, the licking and swallowing the dust. It can be inhaled too, and there are other cases where chips end up in folks' mouth because it actually tastes sweet for babies. But it's kind of all the above, and the solution is improving houses, so doing home repair, replacing windows, porches, and doors. It's demolishing old houses that will never again poison a kid after they've been demolished. And it's also building as many new homes as possible. And so for the past few years, we've been doing that work. And along with the Lead Safe Coalition, a bunch of organizations across Cleveland, our new lead poisoning rate is now 14% in 2025, down from 18%, and it's looking like that trend is continuing in 2026.
Yeah, a big key to this is demolition, isn't it? Because there aren't as many people in the city of Cleveland as there used to be. Some of these older homes, do we need all of them? Do they need to be refurbished, especially when the better alternative, if you can find the money, and believe me, I understand the financing of this is the critical thing,
right.
But it's better to build new than it is some of these older homes that are loaded with lead paint.
Yeah, I am a huge supporter of demolition as one way out of this. The key, though, is just like you said, we got to build new homes. We got to build new homes that are affordable, so we're not dislocating people. But as our population has dropped from 1 million to 372,000, we've got homes that can be demolished and will never again poison a kid after it's taken offline.
Homelessness, unfortunately, is a problem. But I know that the Home for Every Neighbor program is a big part of what you're doing. What is that? Is it working? I know it is.
Yeah, so when you look around cities across this country right now, and you'll see it on national news, there are homeless encampments. It's just become an accepted part of urban life in many places across the country, but not in Cleveland. And what we've done in Cleveland is we've developed this Home for Every Neighbor program. It launched August 2024. We have housed over 200 people directly from the streets with intensive case management and a home of their own for 12 months. And we've been able to resolve over 60 campsites. And so now, you might know of a few people here and there sleeping outside, but we're working quickly with them to get them inside and taken care of.
And there are stumbling blocks to that, because there are just some people who resist this, unfortunately, for a lot of reasons, mental health reasons, in other reasons that may be very, very important to them. But the work that you've done so far has really, really worked.
Yeah, and we think we've sort of, solved a lot of these misconceptions, because what we found is folks who are not going to the shelter are not going, not because they don't want help. It's because they feel safer outside compared to the shelter. And it might mean because they have a dog, or they have an opposite sex spouse, like a man and a woman can't go to our shelters today because they would have to separate. And so we're meeting those folks where they're at. And 99% of the folks that we've offered a home to with case management, 99% have accepted.
Wow, those are great numbers, and certainly a lot of reason for us to feel like we're on the right track there. A lot of good stuff happening at the Cleveland Department of Public Health, thanks to you and your great staff over there. So thank you, Dr. David Margolius, for being with us. We appreciate it. That's going to do it for this edition of 19 Newsmakers. Hope you'll be with us every Monday night. We stream this show at 6:30. Then you can find it on our website. It's there all the time. All of our past episodes are there. Also there as a podcast wherever you find your podcasts. Thanks for watching.